So we looked at patients who had heart failure in their problem list, and we analyzed their charts. What we discovered is that we had more chart failure than heart failure. 30% of the time, if they had heart failure on their problem list, they did not have heart failure. Now I have to tell you, I did not believe that this was possible. So I called up a colleague in New York who runs a large cardiology clinic, and I told her what I did, and she came back 2 weeks later with her results, and she said, yeah, I don't know what you were looking at. I got 50%, okay? So 30 to 50% of patients who have heart failure in their problem list don't actually have heart failure. So we've got false negatives and we've got false positives in our structured data. We're toast. How can we do any analytics? Let's just all go home right now. Just forget it. Now doctors seem to get it done. So what are they using? They're using text. They're making notes, they're taking dictation, they're sharing letters with each other. So what we discovered is that most of the information is in the text and the scanned documents. It's in unstructured data. But luckily, we have technology. So let's see how that can help us with the heart failure example. We have our 7 true heart failures and our 3 false positives. And we take them and we graph them into a little chart. It's a little hard to read. Across the bottom is ejection fraction, and the vertical axis is edema. Now, I made this up. I'm not a doctor. This is just kind of roughly what happens. But if we take our patients and we plot them on that graph, now we have them spread out, and we can label them whether they had heart failure or not heart failure.